Welcome back, everyone. July is National Minority Mental Health Month. Joining us this morning, Dr. Delvena, a national advocate for mental health awareness. Dr. Delvena, good morning.
Hi,
thank you for your time.
Good morning. Good morning.
We are so happy to have you here. Not only a board certified psychiatrist, but also lieutenant colonel in the U.S. Army Reserves for 14 years. You've had a very extensive career in the field of mental health.
I have. I've seen a lot. I've treated many, and I've done a lot. And I want to share everything there is to know about mental wellness. What we have to do, we have to talk about it more so we can end this stigma. There is a stigma out there.
And awareness is a big part of it. How does one pursue a healthy mind? What are some of your expert recommendations?
Well, so I have this thing called brain love, and so these are the things that someone has to do every day in order to balance themselves mentally. B stands for balance. You have to balance work and play. You can't have all work and no play, and also you can't have all play and no work, right? R is to reframe. You have to reframe your situations. Whenever something bad happens, you can't just look at the negativity, you have to look at the positive side also. A, avoid negative energy. Avoid negative people, avoid people who do not mean you well, avoid people who stress you out. I, inside. You have to look inside yourself. This is called gratitude. You have to look at yourself and say, what am I pleased with? What am I proud of? What do I have? What's positive about me? N, your needs. You have to look at the needs that you have in your life and address those needs on a daily basis. Love. L, limit your expectations of yourself. Don't try to overexceed. Say no to people when people are always piling things on your to-do list. You have to learn to say no. O is ownership. Own your mistakes. A lot of times people get stuck on their mistakes. They don't want to own them. Just admit that you made a mistake. We're human. We do that. Move on. Learn from it. V, vengeance. Vengeance is not yours. Vindication is not good. Forgive people. And the last one is E, express yourself. Many artists have made songs about expression. Madonna, Salt and Pepper. It's very important to express yourself so that you don't go to bed at night and have regrets about your day, about not talking to someone. Communication is key. Brain love, some great tips right there. And can viewers find that on your website as well? They can. My website is drdelvena.help, H-E-L-P, as well as I'm on Facebook, Dr. Delvena, and also on Instagram and Twitter. If any of our viewers out there are thinking, yeah, this has been an issue for myself or a family member or friend, what's your first recommendation? Should they go to see someone, a professional right now, or should they just sit down and talk with their respective family? They should absolutely go and see someone. Why not? We have access to care now. Unfortunately, with everything that's happening with the Affordable Health Care Act, in some of the southern states, people are not getting the health insurance they need, and Medicaid has been set. There's been limitations with that because of money. But if someone has health insurance, if they don't, you can go to a community health center and you can seek out a mental health professional, a psychiatrist, a psychologist, a licensed clinical social worker. You should sit down with someone and express your needs. You should also make a treatment plan with them so that they can make recommendations. It may not be medications. A lot of people fear mental health treatment because of meds, but it could be psychotherapy. It could be something as simple as exercising and changing your diet. It could also be prayer and meditation, all of those things. And you mentioned earlier in the interview about the stigma associated with mental health and mental health issues. Why do we need to get away from that, from the negative association, and truly help people that suffer from that? We are a reactionary society. America is very reactionary. We're not proactive. We have to talk about these things more and tease out these issues so people are not embarrassed. People see mental illness as a weakness. It's not a weakness, and this is why the suicide rates in young black kids has doubled in 10 years. Kids ages 5 to 11, little black boys are killing themselves by hanging. And this is because people are not encouraging them to talk about their problems. They're not bringing them forward. They're not helping them. They see it as a weakness instead. Dr. Delvena, thank you for your time, and thank you for helping raise a little more awareness on the issue. We do appreciate you. Dr. Delvena. We'll have much more Local 33 News today.